Welcome, friends, and thank you again for tuning into the Optimal Health Program. Hope you're all doing well. Today, we're going to talk about a variety of things. Of course, take your calls here at 1-888-420-9272. We have our Instagrammers, our TikTokers, our Reddit followers, YouTubers. I think we're on 17 or so different platforms, and we're very happy to announce we're adding another wonderful platform on Saturday, tomorrow. So we'll talk a little bit more about that tomorrow. Lots and lots of viewers on that platform too, so very, very excited. We're going to be interviewing a few people. I have a plastic surgeon in the lineup who is going to come in and tell us everything about the new modalities and things for plastic surgery, different techniques, historically, some great info. This gentleman works both in Manhattan and Long Island, and he's the director of plastic surgery in two big hospitals. So we'll talk about that a little bit more tomorrow, and we'll see what day we can get him to do the interview. If you like the program, which we hope you do, please like, share, subscribe if you can. There's no cost to anything, of course, for subscribing and such. I don't know that people make people pay to subscribe to podcasts.
It's beautifully free. It's free for all.
Excellent. Yeah, because I've heard that some people charge to subscribe. I don't understand why they would do that, but
we would never.
The topics of the day include metabolic syndrome and insulin resistance. So these are two extremely common problems that we see occurring in our population. And this has occurred for many years because of improper diet, not enough exercise. There may be some genetic component to this, but a third of the population, it seems, has metabolic syndrome, which is horrible. That's 100 million people. And the people that have this scenario either progress to heart disease, diabetes. The overall view of metabolic syndrome is that people are overweight. They have hypertension, high blood sugar, high cholesterol, triglycerides. They may have components of fatigue. Their waist circumference may be larger than it should be. And, of course, as the sugar stays elevated in your blood and the lining of your blood vessel could be affected, you could damage your blood vessels with sugar, just like the people that are, pre-diabetic and full-blown diabetic. As the fats, triglycerides, and sugars also increase, that can create plaque and damage. Glycation is a term that describes the damage that sugar causes to individual cells. So it's something we have to take a stance against to change. Other countries throughout the world really don't have this type of problem because their diet and activity levels are far better, and they're not eating junk food. They don't have tons and tons of carbs, as the Western diet seems to correlate with. So when we talk about changing the mechanism, it's relatively easy to kind of put this into your own hands to change the picture. It's not as though we want people to take drug after drug to try to change the mechanism, because it's a more natural recommendation or recommendations that we can do to improve the picture. It seems as well people that have excess thirst or they're urinating a lot, those individuals that may have some changes or blurring in their vision or fatigue may have some of the symptoms that can be a harbinger or a warning of metabolic syndrome. It seems as well women have a higher risk, and Hispanic women seem to have a higher risk. So we'll break down how we can change the mechanism. If we talk a little bit about insulin resistance as well, this is a problem where your pancreas makes insulin to try to control your blood sugar. And when sugar comes in with your diet, your blood sugar goes up. You normally would release insulin to take that sugar, put it into your cells for energy, and to allow your cells to function. But if the insulin is not doing that job and the sugar stays elevated, that's bad. Your body doesn't see the effect of the insulin, so it makes more insulin. So you have hyperglycemia, high blood sugar, and hyperinsulinemia, high insulin. And just as with metabolic syndrome and as well with diabetes, this excess sugar causes damage. So similarly, and there may be more people that have insulin resistance because most people don't think of it or know about it and don't realize it. Typically, these people are some that try to lose weight, but they can't lose weight. And similar with metabolic syndrome, they have a hard time losing the weight because you have to correct all of the things behind the scenes. So when we talk about this in the office and I sit down with patients, whether it's their consult, And I'm always asking questions to try to determine if they're developing insulin resistance or the metabolic syndrome. We're looking at this entire picture. We start talking about diet, of course, and exercise and hormones and heavy metals and a variety of things to be able to understand why their body's in this position where their weight's up, their blood pressure, cholesterol, triglycerides are up. They're not able to lose weight. They try to do a little bit of exercise, doesn't do that much. The best results are seen, as I've mentioned many times before, when you correct each part of the problem. It's not just trying to do exercise or walk every day, but still eating carbs and ignoring the testing for hormones, vitamins, etc. So when we get your big blood test done, the comprehensive medical nutritional approach, our big 20-some-odd page blood test looking over 200 things, we can then see exactly what's going on. So the initial recommendations would be cutting the carbs down because as you decrease the sugar intake, your body has an easier time handling less sugar than it does with more sugar. And we'll talk about vitamins in a minute too because there are nutrients that will help your body deal with the sugar. So if you cut down the carbohydrates, and for most people we talk about doing about 30 grams of carbohydrate per day, and we have good protein sources, lots of vegetables on board, but we keep the carbs into a tight range. People tend to feel better. Bloating goes away. For some people, they can get up and move around a little bit better. You're just taking that huge sugar burden away from the picture. If then we also look at exercise and recommend that everyone does a half hour to 45 minutes a day of nonstop exercise, as you've seen me talk about walking around the block, slow, brisk, fast, and then getting it to where you're walking around brisk and fast, keep changing the speed corner to corner because it's easy to hit your mark when you see that corner. Your goal is not far ahead of you. You'll start to flood your cells with oxygen, vitamins, minerals, hormones, burn sugar, burn fat. So that's really, really important. You can do an indoor bike, outdoor bike. If the weather's horrible outside, stay inside, but do something. I have some patients that just walk between the rooms of their house, go up and down the stairs, whatever you'd like to do. It makes sense. Some people like to go to the gym, as I do, love to go to the gym, and you can do cardio in the gym. You could do weights. You could do Pilates and yoga at facilities or do some of these things at home. So everybody should be doing a half hour of activity every day as a minimum. If then we find that your hormones are low, like your thyroid, correcting your thyroid will burn sugar and burn fat because that's what it does. It creates your basal metabolic rate, your metabolism per se, part of your metabolism. So if we raise up a T3 or T4 that's at the low end or absolutely low, then as you correct the carbs, do the exercise, and now your thyroid's better, you get a greater result because now you're fixing more things. If testosterone's low in men and women, it's also a great fat-burning hormone. So in a way, it could be that the decline of hormones is a starter for this medical problem, and too much carb and not enough exercise are all starters of metabolic syndrome and insulin resistance. If we correct testosterone for women, which could be a little 5 milligram pellet you take under your tongue, that could be great to bring you to the level that you need to be between 40 and 50 on your blood test. That also will help to prevent osteoporosis. For men, they need to be at the 700-800 range to get their best result, and we can either start with a shot once a week for a few weeks to get that to come up. Then men will feel exactly what they should be feeling. Better sexual drive, memory, focus, mood, concentration, anxiety goes away, and your muscles feel good when you exercise. We can also do sublingual pellets, but those are 40 milligrams instead of the 5 for women, 40 for men. We can put pellets under the skin so that they stay there and are slowly released into your system over the course of 5 to 6 months. So one 5-minute procedure will cover you for that period of time. That's a great mechanism, great way to do it. If we see that the IGF-1 levels are low, IGF-1 is the active component of growth hormone, which your body has had since you were conceived. And for those people that are tall in their teens, they have more growth hormone, so their bones are continuing to grow before age 19 when your bones tend to seal off and the end plate closes and you can't become taller. People that are shorter have less. But as you get older, if you don't have enough of it, you're not sleeping well, your hair, your skin, your nails will suffer, fat burning decreases, endurance, strength, muscle response to exercise. You just don't feel good. And I can tell you there's a large number of patients that I see, a large percentage of my practice, are people that are in their 30s, 40s, and 50s that say, excuse me, I can't lose weight. I'm not doing well. My focus, my concentration's off. My sex drive is off. So, excuse me, those individuals are large in number because everybody starts to drop their hormones over that period of time. And correcting them, we walk you back to where your body had those hormones and creating those results. So low carb, exercise, hormone correction, and vitamin correction. Nutrients are important to help insulin work. You've all heard of chromium. You know, chromium is a great mineral that helps to get your body to control your glucose better. And when we put chromium on board, you seem to have tighter levels of your blood sugar fluctuations, which makes sense. So these are all great add-ons. You know, sea cucumber, and there are a few other ones that may help. There's some Ayurvedics that may be beneficial. But each of these things has its own job and has its own significance in repairing your body. So if we talk about the subtlety of all this, you may have 100 people come in, and let's say the first 5 people have low thyroid, but the other hormones are good. And the next 5 people have low DHEA, adrenal hormone, and the other hormones are good. And the same with testosterone or IGF-1. And then the larger body of people will have a decline in thyroid, DHEA, testosterone, IGF-1, and their vitamins are low. So I see all variations of this, all different colors of the spectrum, per se. So we're looking at fine-tuning and correcting every single hormone, vitamin, mineral, exercise, low carb. We also might use peptides. NAD works very well to improve your ability to have focus, concentration, energy, burn fat. For some people, we talk about doing the weekly injectables because they can decrease sugar fluctuations, decrease your cravings. So this is the comprehensive mechanism that can help to work on these medical problems. The other concern, too, is that if a third of the population have these issues, metabolic syndrome and insulin resistance, there will be many, many, many people that become diabetic. There will be many people that will have plaque in their blood vessels and damage to their organs. This is sort of an insidious thing that you don't really see. You're not hit over the head by something like you would be with a bad allergy to something or a horrible headache. These are things that just sit there and constantly brew, and you want to catch them early so that you can reverse it and prevent the problems. As another aside, in thinking about the process, we have a cardiac group that comes into the office to do testing for your circulation. So if a person is overweight, high cholesterol, high triglycerides, vascular complaints, cramping in their legs, a little lightheadedness, etc., palpitations, we can do the sonograms, carotid sonogram, to look for plaque in your neck to see how much you've progressed down this bad path. Look at your heart, ejection fraction, strength of the heart. If your CoQ10 levels are low, then you may have a decrease in contraction. People taking statins for cholesterol, the statins wipe out CoQ10 because CoQ10 creation is in the pathway of your own production of cholesterol. So the vascular tests give us a wonderful next step picture of how much you're progressing into this bad zone. So a lot of wonderful information, but as I say, the most thorough, comprehensive approach will give us a complete picture as to where you are, and then we start to change the picture, and it's not that difficult. 888-420-9272 is the number if you'd like to call to ask a question, 888-420-9272.
So we got a quick question on Instagram. Just says, Sal Pickles asking, any help for Parkinson's disease?
For Parkinson's disease, of course, we certainly have people take a look at the videos on my website. We've got some great Parkinson's, MS, Alzheimer's videos, cluster headache videos, joints, etc. But stem cell therapy is the best and most natural mechanism you could do to help your brain. So we could pick any organ, any tissue, any degenerative disorder. When we talk about stem cell therapy, there's a massive amount of research that describes how your own cells, once we take them from your body, and we put them back in through an intravenous procedure and then drip them into your nostril to hit the back of your nasal cavity into your brain, will bring brand new cells to your brain and help with Parkinson's, Alzheimer's, MS, stroke. drcalapai.com is the website, but the videos there will show you things that you probably wouldn't believe. because traditional medicine is not about this. They're looking at meds, 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 and those people keep getting worse with all the meds. And there are side effects to the meds. But when you use your own cells, you're allowing your stem cells to become brain cells, heart cells, liver, kidney, pancreas, gut, joint cells. I will tell you that there has been some great research over the years. Not that I'm prejudiced to research done in Italy, but they do some pretty cool stuff. All of Europe, France, Germany, even Japan. I mean, there are some great facilities doing research that just doesn't get done here. And one of these studies I've been talking about for years. They took people who passed away from Parkinson's. And as those, people donated their body to science, thankfully, we were able to see that the substantia nigra, which is the middle part of your brain, a darker color of your brain, hence the term nigra, it's darker, it is damaged by heavy metals. And when they did sections and testing and all this chemical testing, they found the heavy metals had some sort of desire to hit and damage the substantia nigra, where you make dopamine. So if the heavy metals are damaging your cells and now those cells won't work, you can't make the dopamine. And that's why they believe Parkinson's occurs. And again, this study was years ago, and I kept following it and following other studies that said the same thing. The other issue, too, is that glutathione is meant to protect your brain, and glutathione is a great free radical scavenger. But in those people in the Italian study, they had no glutathione in their brain at all. And the researchers were baffled, but then as they looked a little further, they realized that the heavy metals were damaging the ability to convert methionine to glutathione in its pathway. So that's what they feel wiped out the glutathione, allowed the metals to come in, destroy the substantia nigra, and create Parkinson's. Now, I'm going to tell you that same pathway occurs for Alzheimer's, for MS, for any of the brain-related disorders, because the metals are the thing that create the damage. With MS, it's thought that the metals help to damage the sheath that coats the nerves. So, and the literature's there. I've seen a ton of this, and you can go on Google Scholar and look at the research as well for yourself. I tell lots of people to do that. So the best mechanism to help to repair the brain for Parkinson's or any of the neurologic or degenerative disorders would be your own stem cell therapy. The procedure doesn't take much time to do. So once we get your consult done and get your blood work done and we start look at all that, look at blood and urine for heavy metals, talk about, removing the metals. When we do STEM, we have you lay down on the table, lift your shirt a little bit, bring your pants down a little bit, and the area that we extract the stem cells from is the crest of the ilium. So I'm not sure how visible this is. Frankie, I guess we can zoom in a little bit. So you can see here that this is your spinal, column with your vertebrae. Your sacrum is the orange triangular bone in between. The crest of the ilium, if it goes towards the back, ends in a little fat bump. That little bump is where we extract the bone marrow after we sterilize and numb it. It takes about a minute and a half to do that whole thing. And then we take that fluid, your bone marrow, which is really, really thick blood-colored fluid, which has all the great stuff in it. It's got your stem cells. It's got platelet-rich plasma. It's got everything in it, immune cells. We then spin that in a high-speed centrifuge, which is a required 4,000 RPM centrifuge, which is ridiculously fast, by the way. And I talked to some people who are old enough to know what a 45 record, was, a vinyl, and a 33 and a third. Our parents or grandparents probably had a lot of those and listened to that. I remember listening to all that when I was a kid. But so 4,000 RPMs is super fast. We spin that for a half hour, and then you're separating red blood cells on the top, plasma, the straw-colored liquid that all your cells are floating in, and then stem cells at the bottom because they're a little bit heavier. So we then take them out, we put them into an IV, and as that goes in, it gets delivered all over your body continually. We may have you breathe a little nebulizer mist to clear your nasal passages, then lay you down on the table, and as we do so, we use 2 syringes with the stem cell and its liquid, and with a little rubber cone on the end of the syringe, we lay you down and put that up against your nostril and drip, drip, drip slowly over 10 minutes, that liquid to hit the back of your nasal cavity on both sides so that it hits the back of your nasal cavity into your brain. And that will create brand new cells, brain cells, because stem cells will become those damaged cells. That's their only job, their only reason to exist. And that's why they do it in all different parts of your body. So I know this is kind of a long-winded answer, but A good question like that deserves a good, thorough, simple explanation so that everybody else who's listening, who may have relatives that have Parkinson's or MS or stroke or liver, kidney, heart failure, colitis, any of these things, macular degeneration, diabetic retinopathy, all of these things, they can hear the gist of how this works. It's a simple idea. I think it's the most genius idea that's ever been discovered in medicine because your body can do dramatic things to heal itself. It may fly in the face of other approaches where traditional medicine doesn't want to see, this take over, but it's a wonderful, wonderful protocol mechanism. Thank you for your call.
And we've actually never had one on Lyme's disease, but I've had Lyme's. This is a Redditor, very important.
Okay.
I've had Lyme's disease for 20 years. Can stem cell therapy help me? If so, how?
So the best combination recommendations for Lyme disease, a little bit varied. So think of traditionally, and you can go back years, in 77 they found this tick in Lyme, Connecticut and figured out it caused the problem, and things started to happen, and they were using 5 days of an antibiotic, a week of an antibiotic, 2 weeks. That never worked because you need a lot more antibiotic to kill that bug if you're just thinking about the antibiotic approach, which is one concept. I do something, once again, that's much more comprehensive. So if you take an antibiotic and you didn't totally wipe out the bug, it'll sit there, kind of hide, and come back stronger down the road. We've seen that a lot. And doctors who thought they were doing a good thing of using a week or two of the antibiotic, everybody saw that the bug came back. The bug can get inside your cells. It could evade your blood test or your immune response to some extent, and your blood test can look like it's negative. But you can't just go by the blood test. You have to go by clinical picture blood test. And another thing that I started doing as a result of learning a great deal about Lyme disease from Dr. Joe Boroscano, who is the greatest mind that has ever been treating Lyme disease. He's retired now, but wonderful, brilliant, brilliant doctor. He's the one that wrote every year the updated, versions of what doctors should do to test and treat Lyme and all these other tick-borne diseases, including rickettsia and such. So when you take an antibiotic for anything, it's not giving you anything. It's helping to kill a bug. Then what? When the antibiotic is gone, your body's no different, per se, than it was before. If the bug is killed, great. The bug's not killed, you're still back at square one. So myself and other doctors over the years, Dr. Atkins, rest his soul, Dr. Hoffman is a wonderful doctor in the city. I think he's retired now, but we would have meetings in Atkins' office in the city and talk about protocols for everything, heavy metals, chelation, you name it. So as a result of that, putting all our brains together, my idea is that, yes, you can use an antibiotic if you think it's early, but you really have to do things to make your immune system stronger. Of course, test your vitamins, minerals, hormones, look for heavy metals. If you have a huge heavy metal burden, that's damaging your body and your immune response. If your hormones are off, if your vitamins are low, vitamin deficiency affects your immune response. Look at all the research on vitamin D, talking about how important it is for immune response. Vitamin C, B6, zinc. There are many things we have to do. So once we understand that big blood test, we'll put people on potentially the doxycycline antibiotic, and we may use that for a month. It depends upon how long we think the patient's had the problem. But we're also correcting vitamins, minerals, hormones, doing vitamin C IVs, peroxide, therapy. So we're doing many things to create a result. And in many cases, that's where you get your best outcome, because you're not just doing, one thing. There are some people who've done hyperbaric oxygen therapy on. Not every facility in the world has a hyperbaric chamber, but there are some here or there, and those can work nicely to help to oxygenate. And oxygenation, can help to kill a variety of different types of infections. So the idea is that your body needs to be fed and needs to be made stronger. If we can get people to do exercise, once again, exercise floods all the good stuff to all your cells. So it's a combined treatment as opposed to just one singular approach. Another long answer.
Yeah.
But that's what I do. I'm full of long answers.
We love it, Doc. So the person who had brought up the Parkinson's that continued. They said, "Thank you for help with the Parkinson's question. My daughter is 16 and has type 1 she's a type 1 diabetic. Can we reverse it?"
So we have type 2s that we've reversed over many years of doing stem cells. That usually takes 2 to 4 or 5 months or so. But again, low carb, exercise, the whole thing. We've had type 1s that have come in that are in their late teens, 20s, 30s, and the stem cells will still go in your blood to your pancreas to help to create more pancreatic cells. So we see those type 1s decreasing their requirement for insulin. I don't know that you're able to completely eradicate that entire mechanism, but you're helping it way beyond anything else because you're putting new cells into the pancreas and you're making more pancreatic cells that make insulin. So that's been, evidence that's been shown. So I'm not sure I would say, oh, yeah, we can do this and you'll reverse it. And there are some studies, and some of them coming out of Europe, and I don't know whether people have done 1, 2, or 3, or 4 or more of the stem cell procedures that are describing that they've reversed type 1. But I wouldn't hang the hat on that. I would just take the mechanism and change every component. We certainly can do the stem for her. We certainly can do the low carb, the exercise, all of these things, and create significant decline in those excess blood sugar levels. A couple of great questions.
Yeah, starting off strong. So we have this one from Reddit, and this one is, "Hey Doc, love the show. So I've got a question that has been bugging me lately. I've been getting this weird tingling sensation in my hands and feet, almost like pins and needles, but it happens randomly, even when I'm just sitting around. No pain, just that annoying tingle. Should I be worried? Could this be something serious, or am I just overthinking?"
Not necessarily something to worry about, but we have to figure out why that's occurring. So in lots of patients that I see, they have some issues with their neck or their back. And interesting, some people have way too many pillows when they go to sleep at night, and when they move around a little bit, all of a sudden their head is cranked all the way to one side or the other. That's putting pressure on the disc, which can also put pressure on the nerve root and cause numbness and tingling. And some people wake up with the numbness and tingling. So I think that part in some people is a structural mechanism that occurs there within the neck or the low back. And the more people you ask, it seems like everybody's got some sort of low back issue. Some people who are very active and athletes and runners, they end up with some disc issues in the back. Contact sports, of course, can create more of that. As you get older, typically back problems increase because of wear and tear and grinding on your ligaments and tendons and your discs. There are some people that may correlate with circulatory concerns that may cause that. So whenever you have something going down your legs or in your feet, you always want to check your circulation as well as checking your neurologic picture. The same company that comes in with the cardiology group to do the cardiac testing for us certainly could look at circulation. You do a sonogram of your leg, look to see if the blood flow is good. Arterial flow down, vein blood return, you can check that. There are also ways to do nerve conduction tests where we can test to see from your back down to your legs if there are nerves involved in that dysfunction or that numbness or tingling sensation. So those are the two things you typically look at. You could also do nerve conduction from the neck down to the hands. So those are simple tests that we do in the office. So gathering the information is always the most important first step. There are some people who, over time, that haven't done exercise to really strengthen their muscles or hold their body in good posture. And we've recommended physical therapy and exercise that can help to give them better structure. And then their numbness and tingling, if it's a physiologic mechanism or a musculoskeletal mechanism, may go away because now they're holding their body in better position. A lot of people, as they get older, they develop that pitch forward, almost like, I don't want to say the hunchback. That can happen if it's really severe. But people can start to pitch forward, and then the weight of the head pulling down can put pressure on the ligaments and tendons. So it's easy once I examine somebody to tell where it's coming from.
We got this one from Reddit. I've got a bit of a weird one for you.
Okay.
Every time I eat something really cold, like ice cream or a smoothie, I get this sharp pain right in my jaw near my ear. It only lasts a few seconds, but it happens every single time, Is that just a normal brain freeze thing, or could it be something else? Like
I
a
mean,
nerve
it could
issue?
be just the coldness of the substance hitting either the nerve that goes down your throat, or there are lots of nerves, obviously, and that can make that occur. Sometimes, if you're constricting blood vessels with cold, and I know a lot of people who have this when they drink really cold liquids or they have ice cream, they'll get that, symptom because you're constricting blood flow, and that blood flow constriction can cause aches and pains. So that's not that unusual. It's relatively common.
Got it. And we have another Reddit. Hi, guys. Just found out that I have mild arthritis on my right hip and maybe in the other one. I'm 45 years old and surprised I got this early. With that said, I was wondering if there is any stem cells that can slow it down. I'm kind of bummed out because it's a progressive disease and I love walking.
Okay. So this is super, super, super common. I think everybody over time ends up with some joint problems. The more active you are, like I say, if you were a runner and you played sports, sooner or later you're going to hear and feel, from your hips, your low back, your knees, your ankles, shoulders, etc. The best test for the hips is the MRI, not an X-ray, because the X-ray only shows the outline of the bone. And if we look at our handy joint model, you have your femur, the big bone of your leg, turning into the neck of the femur and then into the ball and socket of the hip that goes into the acetabulum. So for people that have hip issues, it's not as though the first thing that happens is damage to the joint, the bone. You have damage to ligaments, tendons, and cartilage. Certainly the labrum is a Teflon-like cushion that sits in the bone, and the ball of the hip, where the femur comes to the neck and then the ball into the socket, should glide there. If there's grinding or damage and you incur a tear, then that's one of the things you could be feeling, pain from. There are other ligaments and tendons that attach to the neck of the femur or to attach to the ilium, etc., to be able to move your leg and do all that. So I would want an MRI because I want to see everything. For some people who don't understand how the MRI works, it's a magnet picture of an area. And I always make the reference to, years ago when I was a kid, going to a deli to get a sandwich and they slice the meat, bologna or cheese or whatever on that big slicer. If you're slicing with the MRI and a CAT scan and looking at millimeter shavings of that area, you're seeing a progression, first the outside and going more towards the inside to learn everything about that joint. So you can see tears in ligament, tendon, cartilage. You can see changes in the bone. You can see edema or swelling, lots of stuff. You can see if a person's got avascular necrosis, which would be damage of the inside of the bone. The bone's not getting its blood flow, so the bone starts to break down. Arthritic changes can occur on the outside of the bone, so you'd see all of that. And the ultimate mechanism to create repair for that would be stem cell. So we do tons of stem cells for hips. We probably do more knees than any joint because sooner or later everybody has some knee issues. And most people today are afraid of going for the full-blown, knee replacements. If they don't have to absolutely do that, then stem is the perfect option. It's natural. There's no side effect, downside, no risk. They're your cells. Second from knees is probably hips, and a close third would be shoulders. But it kind of goes back and forth. So, and then low back, of course. We work on the ligaments of low back, sacroiliac. So it would be an important thing to first get examined. I would certainly examine you, look at ranges of motion, see where you have pain, decrease. If you had an X-ray done, bring that, so it just gives us the bone picture, but then the MRI is the king. So that'll tell us exactly what we're dealing with.
And we have one from YouTube. Can stem cell therapy help my emphysema?
Yes, absolutely, positively. So there are two great videos on the website, drcalapai.com. A gentleman named Dennis and a lovely woman named, I forget her first name, but she's lovely. It'll come to me in a minute. So both had significant COPD, emphysema. The lovely woman couldn't walk down the block to go to the supermarket, and she would take, her cart, Jerry is her name, and she would walk down with the cart, but over time, over the years, she just couldn't do it. She had shortness of breath. She was taking inhalers and things. And she was unhappy because she loved to do that and do that with her grandchild and her kids. Dennis, same thing, was using the hair all the time. And we sat down, went over everything for them. I always look at magnesium, potassium in the red blood cell blood test because sometimes low magnesium, potassium tightens the muscle around your airways, makes it harder to breathe because if we correct the magnesium, potassium, we'll get more air in. It's not going to change the degeneration of the lung tissue, the alveoli, the air sacs. But in doing STEM, same thing. We numb, sterilize, extract, a minute and a half, spin it for a half hour. We do IV to get it to your blood, which will go to your lungs, by the way, through your blood. That's a great vehicle. We also will take a nebulizer, the handheld device with the chamber, but I put the stem cell liquid with the cells in that nebulizer chamber. So as the air passes through, you breathe that mist and that stem cell that you're topically putting on your lungs. So the great evidence is that by doing the IV part and the nebulizer, topically, you're getting two approaches to the lung, which create repair and decrease inflammation. So Dennis's video, and you'll see, he says that the same day that we did that, he walked out of the office, felt good, wasn't sure about anything yet, felt good, but then he and his wife realized that whole day he didn't use an inhaler, and he was using it 3 or 4 times a day. Then, of course, he called us the next day and said that. I said, that's great, keep tracking, and I make people, force them, to write down every day how they feel. But whenever we do an IV stem cell, I tell them, I want you to tell me from your hair down to your toes. Do you think you have any changes or improvement in your hair? Because you will see that because stem cells go through all your blood flow. Tell me about your focus, concentration, memory, mood, sleep, vision, color vision, sense of smell. Do you have congestion where that's gone now? Your voice, your lungs, your heart, every part of your body. And invariably, people will talk about other benefits as well. So he had a very quick benefit, and Jerry, and I've seen her many times over the years. Her best story was like a couple of months after STEM, probably 2 months. She went to her grandchild's soccer game, and she parked her car in the parking lot at the school, had to walk downstairs, this hill, and go watch the game, sat there and watched it. When she came back, she walked up the hill without a problem, went to a car and drove home with the family, and she was blown away. And she's been doing wonderfully since. So I think the last time I saw her was like 2 or 3 weeks ago. But yeah, you could look at those videos and those people will tell you exactly how they felt and what they went through. So important.
Crazy. Instagrammer.
Awesome.
I was injured via lifting a few years ago, and I was diagnosed with a mild herniated disc in my lower back. My line of work requires strenuous back movement, and I am desperate to find a fix. I have half-assed tried peptide therapy, and not much happened. PT and chiro doesn't seem to do much.
Well, peptides really wouldn't change the disc mechanism because it's not helping those ligaments that may have been strained that are supposed to hold your vertebrae in a nice, tight, firm position. Physical therapy would help to stretch out muscle spasm, which is typically nice because it helps to take some muscle spasm away from the pressure to some extent on the nerve roots coming out off of the spinal cord. Traction could be an advantage. And depending upon where in your low back you have this issue, we would want to know and certainly see the MRI. For those individuals, we do a combination of things. So yes, we may correct vitamins, minerals, hormones. We may inject stem cells into the ligaments like sacroiliac, etc., to help strengthen there and give us some stability. Recommend physical therapy. There are also a couple of chiropractors that have traction tables that you lay down on. They're called VAX, VAX-D tables that will give you some stretching and take some of that pressure off of the disc. And to some extent, we'd like to see that disc can slide back into position or take some of the pressure off the nerve root. So, again, I don't know what your vertebrae look like because when the disc narrows, sometimes that space for the nerve to pass through, which is, as you see, the yellow nerve roots here. I guess you can see that. If the bones get too close together and there's narrowing of that space where that nerve root should exist somewhat freely, sometimes you have to cut away that bone if it's hitting on the nerve. So that's foraminal encroachment, encroaching on the foramen, which is sort of the window where the nerve passes through. But again, I'd have to look at all that to see what the specifics are of your case. But the MRI would show that.
Okay, another Instagrammer. Every time I stand up too fast, I get really dizzy for a few seconds, like I might pass out. It's been happening more often lately. I've heard it could be dehydration, but I do drink a lot of water. Could it be something else, or
Could be a few different things. Sometimes vitamin, mineral, hormone deficiency will correlate with that. But dehydration is common because you have to think of how the pressure of your column of blood is going through your body. So this may be a slightly different idea than most people are used to, but let's say for discussion, you're looking at pipes. And on one pipe, we have fluid in the bottom of the pipe, and the pipe has an opening to an area where I can squeeze a bulb, a rubber bulb, and push the water, and the water now goes up the column of the pipe. If I pump it again, just like your heart might pump your blood, you're pushing that water up the column. When you're sitting down and that column pressure, or the pressure head of that blood going up your head, if you go to stand up quickly, sometimes there's a lag between the amount of time that blood will be pushed up into your brain to oxygenate your brain. Sometimes that lag time will make you feel dizzy or lightheaded because it's not as though you have that 100% same pressure of blood being pushed through all your blood vessels at the same time. I know it's a little bit hard to describe it, but for some people that are dehydrated, if you drink a good amount of fluid, the dehydration gives you that better column of pressure for the blood to be able to go up in your head. Some people have that when they're laying down and they get up too quickly. It's the same thing. There's a little bit of a lag for that blood flow to get up to your head. For people that get up slowly, that can decrease or it doesn't happen. But I'd also want to check a few other things. Your blood work may give us some good information on that. Magnesium, potassium levels, etc.
Interesting. Okay, another one, Reddit. I get these random muscle twitches like in my eyelid or my arm, and they come and go without warning. They're not painful, just annoying. Oh, I could relate to this one. Is that from too much caffeine, stress, or something I should actually be worried about?
It's probably coming from a ghost or an extraterrestrial creature. I had to throw something crazy in there. It's usually magnesium, potassium deficiency, which makes your muscles twitch. So it's hard to say that people are drinking so much caffeine that they're going to be twitching randomly. I think what you're talking about is now and then your eye starts to twitch, you got to rub it, or your muscle in your arm twitches. So sometimes it's something as simple as having a decrease in red blood cell levels of magnesium, potassium, calcium, because those minerals are involved in what we call the action potential of the nerve. What that means is that the nerve is resting, and then a stimulus comes by to make the nerve in your muscle fire. So when it fires, this action potential, this electrical impulse, shoots up and then comes down, and it starts to relax and rest and is ready to fire again. In that time between firing is the resting potential where you can't fire again until those nutrients shift on either side of the cell, the membrane. So it's probably from deficiency of the nutrients, and some people it's dehydration too. But again, we look at the whole picture, including your hormones, vitamins. That's easy to fix.
Another Redditor. I have alopecia areata, mostly on my face. I'm self-conscious about it and was told by a few people that stem cell therapy may help. Is this true?
It may be. There may be an autoimmune, and we think there's autoimmune connections to alopecia, so we'd have to investigate that. And whenever we talk about autoimmune, the same discussion includes heavy metals. So you'd be surprised how many people have heavy metal exposure that they never knew about. Teenagers, maybe less so, but we see a lot of teenagers that have aluminum from underarm antiperspirant, pots and pans, aluminum foil, mercury in fish or fillings of their teeth, arsenic, chicken, shrimp, rice, apples, blah, blah, blah. So we have to look at that. So I would look at the autoimmune mechanism, blood test for that. I would look at the heavy metals through blood and urine and try to get an idea as to why that's occurring. So when you do stem and you put stem into an area where there's damage or degeneration, you're making brand new cells. So for people that have hair loss on their head, we've done stem cell injections to help to create repair and growth. We've done it for people that want to do facial rejuvenation. So the stems can be put anywhere. Just depends upon what we find is the underlying cause.
All right. Instagram live chat again. With stem cell therapy, do you take blood from your bone marrow from the hip? Question mark.
So you're taking bone marrow from the crest of the ilium. And can we zoom in on this? So this is the crest of your ilium that goes down in the front and down in the back. As you can see where my finger is, that's a fat little bump on the end of that crest. That's where we go. So either side, sometimes if people want to do a double dose, we do both sides, but either bump is where we can numb, sterilize, extract, and it takes a minute and a half to do that. We then take that, put it in a centrifuge vial, spin it, and get the stem. So it's a very easy process.
All right. YouTube. I've noticed my feet and hands always feel colder than the rest of my body, even when it's warm. My fiance says my feet are like ice cubes at night. Is that just bad circulation? Or could it be
You hear that all the time.
something like a thyroid issue?
It could be a decline in thyroid function. That's possible. In some people, their vascular tree may be a little bit compromised or maybe creating part of it. Interesting, some people that take fish oil can have improvement in blood flow going through and down to their little blood vessels of their feet. You know, traditional medicine might use medication to dilate blood vessels, but if we can do it nutritionally, that might be better than doing it with a medication because medications can have side effects. But that's not that unusual. So yeah, your blood test would tell us. Think of it, you know, your aorta, which comes off your heart, is a big, thick tube. And it comes off your heart, turns around, branches go up to your neck, up to your brain, carotids, jugular, etc. And that big fat aorta comes all the way down your body and then branches off to your lungs, to your kidneys, renal artery, to your legs. And the furthest place from your heart are your toes. And you don't have really big blood vessels pumping into your toes. You have small blood vessels. They get smaller and smaller and smaller as they go down. So it's not uncommon, but we would rather try to use more natural things to help to improve circulation. And we could do circulation tests to see what the blood flow looks like getting there. But I would check each of those things. There is some occasional weird occurrence, but usually occurs in older people that have bad backs. And the nerves that govern the blood flow in the vessels and how they open and close, you know, the nerve component could also affect the blood flow.
We got another one, Reddit.
Wow, let me just give the Reddit people a hand today because they are completely taking over.
Let's go.
This is awesome. Thank you, Reddit people.
And we'll be on Rumble tomorrow.
Awesome.
So we love it. All right, so this is a 31-year-old male.
Okay.
He says, I've been getting these weird random chest flutters, like my heart skips a beat for a second and then goes back to normal. It doesn't hurt at all, but it freaks me out. Is this just stress, coffee, or could it be a heart issue?
It could be a variety of things. Usually a mild flutter or palpitation is not a full-blown heart problem. If it were a full-blown heart problem, it wouldn't go away. But a lot of people have palpitations, yes, because they have too much caffeine in their diet. And caffeine is a stimulant. And look at all the other stimulants people have. You know, some people use these energy drinks that have a ton of stimulant
Monster.
in it. Yeah, you know, years ago, people used to use Rip Fuel, which was a supplement that had ephedra in it, which is really bad. And that caused people to have full-blown arrhythmias. Even some athletes died from taking too much of it. So, yes, it can be coming from stimulants. It could also be from low magnesium, potassium, and calcium because they are the things that your heart uses to contract for its action potential, its cardiac nerve to muscle control. So, and there are probably some people who have middle back problems, not upper or lower back problems, because the middle of your back, the cord and the nerve roots go to your skin, your muscles, and your organ and go to your heart. So some people might have back issues that correlate with that. But it's easily corrected once we find the cause. It's usually mineral deficiency.
Well, this isn't so much a question, but someone said, I made an appointment to see Chris in March looking to get NADIV
Awesome.
and
Phosphatidylcholine.
There you go.
Awesome.
Blood test for minerals, vitamin,
Good.
aminos.
I love it when people are forward-thinking, obviously, and want to learn. It just gives me a really good boost. Makes me think that people are wanting to be healthy, much more so now than I think ever before, especially after all this garbage we hear over recent years about things that are going on with medications and side effects, and medications having to be pulled off the market, and side effects to all sorts of things. And most people know what I'm talking about. So you've got to take your health into your hands, maximize it, eat right, exercise, get perfect vitamin levels, get perfect hormone levels, and you can take on the world. And, as I say, I've been doing this, I graduated medical school in 86, so 39 years of this idea, this thought process, this desire to learn everything and fix everything, and our patients get terrific results.
We got a case to solve right here. We got a Redditor that says, "Hey Doc, I got a mystery for you.
Okay.
Every once in a while, I get this weird metallic taste in my mouth, and I have no idea why. It comes and goes. I'm not taking any new medications. Any idea on what could be causing
It can be
this?"
from a couple of different things. The first thing that comes to mind is heavy metal exposure. So I don't know how old the person is, but or if you have fillings in your teeth, because the silver fillings in your teeth are 50% mercury. They snuck that in there. They thought it would be a good thing because it would last forever, but it's horrible. It's very bad for you. It's a poison. And a lot of the mercury fillings affect your thyroid because they can cause heavy metal damage to the thyroid, causing autoimmune thyroid disease, and that's been documented in traditional literature. But it could be heavy metal exposure. Some people may have inflammation in their gut, which can come from either food allergy or bacterial infection. Some people have sinus issues, and they have that strange sensation. But there are a few different things that can cause that, but they're not hard to test.
Then we have one. I know you've mentioned the jaw situation with tightness, but this one is I keep waking up with a sore jaw and headaches in the morning. My fiance says I grind my teeth in my sleep, but I don't even realize I'm doing it. Could that actually be causing headaches? And what could I do about it?
Absolutely, positively. So there are issues with your jaw. Everybody knows TMJ, temporomandibular joint syndrome, where you have inflammation in the joint. Sometimes the jaw tilts to the side, and one jaw is a little bit more open, the other's tighter. That absolutely can cause headaches. Any jaw dysfunction can cause headaches. Grinding of your teeth is a bad thing because you're grinding down, and some people will crack their teeth from grinding too much. The simple comment on what to do for grinding the teeth is that you can go and get inexpensively these mouth guards that you could have, and similar to the ones that you whiten your teeth with, the ones you can get, in the store, whether you want to add the whitening gel to do that or not. You can put those in your mouth, and you're just grinding on that rubbery mouth guard, that little device you put into your upper and lower. There are some people that opt to go for a more significant device that dentists can make, but then that comes with some significant cost. Sometimes neck issues will predispose to that, so we have to check to see what's going on your neck. And stress will make people grind their teeth, so we have to start working on the stress response and see if we can help to modify that. Because you can't let the stress be there and not try to help to change that.
And similar to that previous question that you had answered with the fluttering of the chest, on Reddit, someone had responded to that question with a follow-up question, said, when I take a deep breath, I feel a little pain under my ribs, like a quick pinch. It goes away when I exhale, but it happens every now and again. Could
Is
that
it
be
in
my
the middle of the chest, under the sternum, or under the rib itself on the side?
Take a break. I feel like a little pain. If you're listening, answer this. But I'm not sure. It just says, could it be my lungs, or is it a muscle thing?
It wouldn't really be lung, because the lung wouldn't change that quickly. So taking a deep breath or maybe arching your body back, sometimes you may have a little bit of a wear and tear or a sprain of the muscles that attach to the ribs. These muscles, remember, are working all the time. They're opening and closing to allow, good, what would be nice to have good deep inspiration and respiration. So sometimes there's a little inflammation at that site. Some people can fall down or hit something and get a little bruise there. That could be painful because the nerves go underneath the rib cage. They go underneath the bottom of the rib and go all the way around to the sternum, around to the front of your body. So there are some weird circumstances where people that have back issues or have hurt the middle of their back, and sometimes that rib, which is supposed to be articulating with the vertebrae, may pop off that little articulating spot, the facet, and then the nerve is irritated, but you feel the discomfort in the front. So that sometimes, I can pick that up because I'm an osteopathic doctor and we understand the musculoskeletal connections to symptoms.
Reddit, man.
Another Reddit.
I've been having my knees have been making these popping and cracking noises recently when I squat down or go upstairs. No pain, just noise. Am I getting old, or is there something I should get checked out?
Well,
I could
we're
relate.
all getting old.
I've been getting cracks since I was 15.
Everyone's getting old by the minute, even when we're born. But, wear and tear starts to create some changes in the joint. And some of the first things people might see is a little bit of instability. They don't have that strength that they have, or they'll feel clicking or popping. Or when they go to press down or they go to move or turn, they'll feel something. That could be the start of wear and tear in the knees. I've had lots of patients that come in and they say, my knee has never been clicking before, but now it's clicking. So remember that the knee is not a steel articulation where metal doesn't really change over a lifetime. And when the ligaments that hold your knees tight together, your cruciates that crisscross inside your knee, which are here, you can see them from the back, they crisscross, they get a little bit lax, and the lateral collateral here and the medial collateral, and you start to have some looseness, you're starting to grind down on the inside, and that grinding can create that dysfunction, a clicking or popping. But MRI, and of course I would examine the knee, have you sit on the table and, bend your knee up, and I would pull and distract and move and turn and rotate the knee, etc. But MRI is nice because it shows you things that you could never see from the outside. So I don't want to say it's one of my pet peeves, but it is. When doctors look at knees and they examine you and they don't want to do an MRI or they do an X-ray and they try to make a comment on the knee without the MRI, it's not a good comment. You're not going to get a true picture. And I've seen people come in because lots of people, thousands of people over all these years have come to me with knee problems and hip and shoulder problems, and they'll bring a report of the X-ray, but it's limited. It's just not a terrific test for ligament, tendon, cartilage, meniscus, etc. So that's why we love the MRI. And now there are great, and there have been for a while, stand-up MRIs where it's wide open. You walk in, you turn around, you put your feet on a little bit of a ledge, and you're laying back on this, not really a bed, but it's a comfy little slab per se, and you have the two MRI. It's almost like gigantic aspirin-shaped discs on either side of you, and you sit there and they lay you back and you go to 45 degrees and they do your MRI. So they're wide open. They're called stand-up MRI, and there are many of them on Long Island. We use one in Carl Place. They're really, really great people, but a lot of our patients from Nassau just go right there.
All right. What else we got? This is from YouTube. I've got a question about my sleep. Sometimes I wake up in the middle of the night feeling like I can't move for a few seconds, and it freaks me out. I've heard of sleep paralysis. Could that be what's going on here, or is there something else going on?
It's not really paralysis because your nerves and everything are working before you go to bed, and they're working great after you wake up. It's just, it may take a little bit of time for your brain to get out of that sleep mode to kind of get everything moving. There are also funny things that people report. They fall asleep, or just about to fall asleep, and their leg kicks out, their arm kicks out. All these crazy movements occur because as you fall asleep, sometimes what you're thinking of, your brain, throws your arm out like you're throwing a ball or kicking somebody or kicking a soccer ball or a football or something. So these things can happen when you're going into sleep or coming out of sleep. So that's not unusual, and I don't think there's anything wrong with that. If you said it took a half hour, that'd be something else. So if it's just a few minutes, it's just your brain kind of getting ready to start the day.
Back to Reddit, we have, I feel like I get dehydrated super easily, even when I drink a lot of water. My mouth gets dry, and I feel like I need to drink constantly. Could that just be the weather, or should I get checked out for something like diabetes?
Well, for people that are becoming diabetic, they have thirst, significant thirst, because their blood sugar is making their blood more concentrated. So you want to have more fluid come in to dilute that concentration. We want people to have at least 6 to 8 glasses of water a day, typically during the morning and afternoon, so they don't have to wake up at night to go to the bathroom if they have it in the evening. It's a metabolic thing. So sometimes people just need more water. People doing a lot of activity or exercise are going to need more water. So I need to get a little bit more background on that individual. So, yeah, you could look at a variety of things to see if a person is dehydrated. Certainly your BUN is a blood test looking at, part of your kidney function, blood urea nitrogen. That can elevate if you don't have enough water on board. To some extent, you might see changes in creatinine, but, not necessarily right off the bat.
And another Redditor. Guys, thank you.
Reddit is king today.
We love it. I read that stem cells might be able to regenerate damaged nerves. I have a relative with a spinal cord injury. Are there any real treatments available, or is it still experimental?
So the term experimental has always been used by traditional medicine against stem cell therapy. So 100 years ago, a doctor called stem cells, and was showing how they differentiate into other tissue. So if you look to see how many clinical trials are being done by doctors all over the country, doing approved research and gathering data for purposes of publication and et cetera, the last time I had looked, which was like a few months ago, maybe 4 months ago, there were 4,000 clinical trials on stem cell therapy, and for all different applications. That's a lot of trials on something that's experimental. So it's not an experiment. You're taking your cells out and you're putting them back in. There's no drug that may or may not work. There's no odd circumstance. So when I looked the other day, because I figured, well, maybe it's 5,000. It's 10,000. There are 10,293 some odd clinical trials on stem cell therapy. And it's been done for years and years and years all over the world, and it's only growing. So it's not an experiment. People think, oh, it's an experiment. Oh, we're not there yet. I hear this all the time from patients who say, my doctor said we're not there yet. I said, look at every big hospital. Johns Hopkins has been doing stem cell therapy for patients. Mayo Clinic, all of these big places have been doing it. So why did they still call it experimental? It's fact. It's true. And they can't be experimental with all the patients that I've seen, which you can look at the website and look at videos on. That being said, it depends upon how much damage occurs in tissue. So if you have a person that has a little tear in their meniscus and we inject it, that person is going to see results sooner because it's a little tear, and those cells will take a shorter period of time to start to make you feel better, and it may take 4 to 6 months before you say, wow, my knee is perfect. For liver, kidney, heart failure, it may take 6 months or a year before we can say, wow, look, there's a big difference. So it depends upon the amount of wear and tear. There are people that have neurologic disorders, MS, Parkinson's, Alzheimer's, stroke, that get great result. But when you damage or you cut the cord, where's the injury? How much damage is there? Was it a complete transection of the cord where the tissue is not really, connecting? Is there some tissue that's still connecting? It's hard to say. But it's been used for spinal cord injury for many, many years. So I don't have in my mind a list of all the studies or the most recent things on stem cell therapy for spinal cord injuries, but I could do that. I could pop on the iPad and look at that literature, and so can anybody else. You can go to Google Scholar and look up stem cell therapy for spinal cord injuries. The literature will be there. So it has been used. I just can't tell you a success rate for something that I don't know the extent of damage on. So it always makes sense to think of doing stem cells for damage and degeneration. I just don't know how much damage one person may have compared to another. But I think it's a wonderful idea.
Okay, we got another one. My fingers are very stiff. When I close my hand and try to bring it up, one of my fingers stays down. That's from Instagram. You know, it took me a second. My wife watches the Instagram questions, and she texts me these things. She texted this to me. I'm like, is this a question, or is this happening to you right now? What's going on? But yes, this is a question.
So when you look at your hand, obviously there are ligaments and tendons that connect all over the place underneath your skin. And when you close your hand, if you have difficulty opening it, the ligaments and tendons on the back part of your hand that attach to the muscles, the tendons, those muscles pull on the tendons, you could open your hand. If the joint itself, where the bones are articulating with a cartilage in between, have some inflammation or degeneration, it may make it hard and stiff to open or sometimes close the hands. If one finger is not moving as the others, there may be some damage or inflammation in the sheath where that finger's ligaments pass through, and some people will develop something called Dupuytren's contracture where, one finger is just not coming up and not straightening up. So looking at the range of motion, looking at a variety of things, I think other things are correlating with this. But to some extent, you want to have strength and movement testing done to see why that's occurring. Other odd circumstances, calcium, magnesium, potassium deficiency may make your muscles a little bit weaker at being able to move and open and close quickly. Arthritic changes can do that, and there are some people who have rheumatoid arthritis, where your immune system's attacking your own joints, and that's part of a progression of damage to your joints. So we'd have to look at all that. A lot of it's through your blood test as well.
We have a general stem cell question on the future of medicine, basically, but it says, I've heard about stem cells being used to grow new organs in a lab. How close are we to actually being able to replace a failing organ with one grown from our own cells?
That's a really good question. So I remember years ago, probably 20 years ago or so, hearing about a stem cell event where someone had their ear almost cut off by an accident or an injury. And doctors at one of the big hospitals, I think might have been Mayo, they took stem cells and they grew the rest of that ear on a scaffold outside, off of the body. And that individual had that reattached. And I said to myself, that's the craziest thing I've ever heard. So then I looked at that. It always stuck in my head that you were able to grow these tissues. Now, it may take a long time. You might also try to, if it's skin-related, have a flap so there's a lot of blood flow going to it and then add the stem there. It's a very good question. I think that will happen in the future. I'm not sure how far away they are with that. I'd have to look into that, look at the research on it, because they're doing so much research on stem cell therapy for organ dysfunction. I think that that's something that's going to come. I don't know how many years, but I think it's going to come because that's the eventual, progression of stem cell therapy.
Crazy. Experimental.
Yeah, experimental. We're not there yet. Oh. Hi. So 888-420-9272 if you'd like to call in or text us or ask us a question. Please like and share the podcast to your friends and family. And subscribe, free subscription. Whenever I hear the word subscription, I think, how many things do I have on my phone that I'm paying for that I never use?
Dangerous.
So I have to figure out how to get rid of all these things that I'm not using.
I can help you out there. It might be our first advertisement.
There you go.
Okay, we got another one. This has been coming up quite often, but I have a friend who banked their baby's umbilical cord, blood for future use. Is this actually useful, or is it just an expensive insurance policy that might never be needed?
Good question.
I love Reddit.
So the expense of banking the cord, if you don't bank the cord and the child has a disorder down the road that needs the cord, you'd be very unhappy if you didn't bank it. I think banking it, even if it costs you a couple of bucks every year, I don't know if it's $1,000 a year, I'm not sure what the going costs are worth it if that child ends up having leukemia or something that would, you'd need that cord. So I think it makes sense because it's their own cord. That being said, if you didn't bank it and you have to go looking for family members that have, a match to treat them, you could do that. But I try to be as forward-thinking and conservative as possible, thinking, you know what, just in case you better have it. Look at all the insurance we have, and I've got a ton of different insurance, health and car and office and this and that, blah, 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 blah. You need to have insurance. If that's one of the things we just have to put into our mind and our understanding of what our expenses are going to be, I think it's worth it. And you could ask people who've used that cord for their child, absolutely worth it. It may save their life. So I think it makes sense. However, that can't be used for somebody else. It's just used for that child, down the road. So Instagram is doing okay today. Reddit is killing it.
Yeah, killing it.
YouTube doing okay, but we need a few more YouTube and some more Instagrammers and some talkers. Where are the talkers today?
Yeah, funny enough. Yeah, let me get back to that.
Is it happy hour and the talkers are out running around doing something?
Yeah, something. It's funny. TikTok's acting a little weird to me because we started live and I see and then the total viewers has been paused, but like we're definitely getting more viewers, but all of my information I don't think is up to date. So we probably have some TikTok questions that I can't see just because they're making some changes in this country.
Yes, I understand that things are going on. A good friend of mine who has two apps, created these apps for social engagement, and it's really cool. The ideas are genius. One of them is called Getting Local, where when you go into a town, you could press the app and you'll see everything in that town. You'll see discounts for dinner, where to take your kids, where to take your dog. I mean, everything. Hotels. And in the hotels that are joining this app, people can hit a QR code and find 24/7, like having a concierge, anything you could possibly want in that city. So it's giving people at the press of a little finger everything you could possibly want. So if you want to go out for Japanese food in Midtown, you'll get these options. If you want to find the coolest place to go for this or for that, or you want tickets to the theater with a discount, these options. The other app is called Pike. And Pike is cool and integrated, and people communicate with each other. But if you want to go to a place that's a new speakeasy, where's the best speakeasy in town in Manhattan or Chicago or anywhere? Where's the best place to go for a haircut, for a shoe shine? How do you enjoy spending $25 on an afternoon in the city? It's all this stuff. And granted, there are a lot of young people in their teens and 20s jumping all over this because they put their videos up and they put their comments up and then other people read it. And the way that this is created, if you have videos up there, those people watching your videos, you get paid. And it may not be a crazy amount of money. Of course it wouldn't, but people watching your videos will keep paying you. So you become your own little influencer. And some of these things that I looked at are pretty cool. So it just engages people phone to phone, where if you want something, you can go and easily learn about it and find it. Now, I don't know, it's Friday afternoon. I don't know that TikTokers are going out to happy hour yet. They're just chilling. The TikTokers may come tomorrow. Yeah. We'll look for them more tomorrow.
And we'll have a Rumble tomorrow.
So Rumble sounds awesome. I know it's a very, very big platform. And the people there have been very kind to us. And we'll thank them tomorrow because I'll know more about that. But it's hundreds of thousands of followers that are going to be able to see our program.
Yeah, 100,000 exactly. Almost,
really?
Yes.
That's Beautiful. Really cool.
So the phone lines will likely be hard to get through tomorrow. So if you got questions, you better be ready.
Yeah, we'll probably start early with the calls because, again, my whole reason for doing this is to give people a little information, give heads up, tell them what tests they need to do, guide them. It's cool to hear about this or that disorder. It's cool to do interviews and stuff, and we'll do some interviews as I've done. But I like to be able to connect with people and explain to them how to figure out how to get healthier, fix their problem. 1-888-420-9272. If you'd like to call in, do so. The office number is 516-794-0404. If you'd like to call in and speak with us at the office, the website's drcalapai.com. And let's see who else we have. We'll give it a few more minutes. If there are topics that you'd like to hear about, I keep forgetting to say this.
Oh, yes.
Then send us a note, give us a call, give us a text. Thank you so much for...
Also, I'll just add, whoever's watching this, if you're watching this on Instagram, TikTok, you can, if you have any questions throughout the week and we're not live on that day, you just send an inbox to Dr. Calapai and we will, we'll have all of that. So you have a question, send us through the social medias, Instagram, TikTok, YouTube. You can
For those
message us.
people, I've been personally answering the questions that are of medical, concern, different medical disorders, because I think it's better for me to answer medical questions. So I do that. Sometimes late at night, I'm doing that, but that's okay. Thank you for emailing the website because we have a lot of people sending us emails. Similarly, as the questions come in here, we get a lot of them there. So I have 3 people working on that, myself, my PA, and my office manager. Let's see. We have a couple of email questions. One from Peter. He had a stroke 3 years ago and wants to know what his options are. Well, the greatest recommendation to repair your brain from a stroke is clearly stem cell therapy. That's not an arguable, it's not a discussion because meds don't give you new brain cells. Meds may help to control your pressure so that if that caused the stroke, that may prevent another stroke from occurring. But I have to tell you, in medicine, my doctor buddies and I and neurologists and all the doctors we speak to, that mini stroke is the precursor to that really big stroke that may be coming down the pike. So if you've had a mini stroke, anything like that, you've got to get your vascular evaluation done. We do that. Your circulation, vitamins, minerals, hormones, metals, all of that, and do the stem cells so that you're repairing the damage in the brain. So if it's a leak that caused the stroke, you got to repair that. If it's blockage that caused the stroke, you've got to repair that. So you can't sit there and say, well, yeah, I've had some mini strokes, TIAs, because the big one's coming. That's just a medical statistic. So same thing with mini heart attacks and big heart attacks. You got to, as soon as something is wrong, got to evaluate it thoroughly and fix it so that you do not end up with a big, bad heart attack or stroke. So look at the videos on the website. You'll see some amazing stroke videos. Let's go to Tammy. She has dermatitis when she eats certain foods. So foods years ago were foods, and they were mostly healthy. Now, foods have tons of chemicals in them, and some of them are GMO. So you could react and have an allergy to the food, or it may not be an allergy to the food because we may show that on skin test or blood test. It could be a chemical in the food or the fact that it's GMO. I have lots of patients that travel. Whenever they go to South America or Europe, any countries, they could have their bread, their pasta, etc., their grains there and have no problem. Here, they try to have that and their stomach blows up within seconds and they're miserable and they've got everything going on that they can't stand and they can't eat those things. Some people may find a good Italian restaurant where they can actually have that pure grain that's not GMO and have those foods. So we see this all the time. I would certainly have you come in to do testing for the allergy mechanism, blood and skin test for foods, trees, grasses, weeds, mold as well, because they can also contribute to that. Let's see. Susan, she's trying to lose weight and she's trying to do exercise, but it's not creating the results that she used to get from exercise. So this can happen in your 30s, more likely your 40s, 50s, or 60s, because if your hormones are dropping, you're not getting the right messages to your cells to respond to the exercise demand. If your vitamins are low, you're not going to get the same response. Thyroid, DHEA, testosterone, IGF-1. So in a perfect world, once we test those things and we put them all into the right range, you'll get the results from your exercise. We do it all the time. It's just that your body's been walking away from being in that good zone, and now we'll just walk you back to create, that repair. So extremely common.
I just want to shout out TikTok. We've gotten our first. We got a donation, Doctor.
Really?
I don't know how much. They gave us coins. It's a virtual payment through TikTok. We'll find out how to retrieve.
Okay, I don't understand what that means, but that's cool.
I don't know. Thank you. Thank you. He said, good program. I love it, and I think he talks about everything that's happening with me. Thank you.
Okay,
you're welcome.
Hopefully, it's not too much. What's happening to you is not too bad, and
I hope we help.
We can help you fix it. But yeah, we love the interaction. I love the interaction, as I always have. 35 years on radio, different radio stations, talking to people in the same fashion I'm doing this now. I'm not sitting at home in sweatpants and a T-shirt on Saturday morning at 8 o'clock. Before I used to get up and get ready to go to work. Now I'm just in a sport jacket and a dress shirt.
And then we have the YouTuber says there's little to no Instagram questions today because it's Valentine's Day.
Oh, maybe that's it.
Maybe.
Oh, wait a second. Now this makes sense to me.
Yeah, and then he said, Happy Valentine's Day, guys.
Well,
happy Valentine's
Day to you,
Antonio.
of course, and to everyone listening.
Yes.
Guys and girls. You know what? Part of me just realized that every man that's ever lived has waited to the last minute to go get Valentine's Day gifts. Coming over here, I saw lines outside of the florist and lines outside of the candy store and lines in Whole Foods for people buying things for Valentine's Day. So, yes, it's the last-minute shopper effect.
Well, lucky for those people, we'll be back live tomorrow.
Oh, yeah. It's the last-minute shopper effect. I can say that there are times that I have been guilty of that. Same thing with Christmas. But thankfully, Amazon has come along and has saved so many lives because we can order things from the comfort of our home, our office, for some, our car, and have things delivered. So it makes it easier than going out to doing all that. But yeah, that's probably it. A wonderful, healthy, happy Valentine's Day to all. Okay, a moment or two more for another call or a question. Otherwise, we will end the longest program of my entire career.
We love that.
82 minutes, 8 seconds and counting. 26 calls I think we did today.
Oh, that's a record for sure.
A lot of good stuff. I love it. So, I'm most happy when we do this stuff. And for people that want to keep asking questions, if we go to 2 hours, that's fine with me. I mean, it's what I do. It's what I like to do. Every Monday and Friday, 12:30, and every Saturday, 2:30. I usually say 12:30 to 1:30, 2:30 to 3:30, but I'm here to do this. So if people want to call and ask questions, you can do that. You could email the website to ask questions as well, drcalapai.com. And we're there. We're good.
Beautiful.
All righty. Thank you so much for listening. God bless you all. Tell your family and friends about the program. Like, comment, subscribe. I love the comments, by the way, because, and I've said this before, being on the radio for 35 years, people would call in and they loved it and they'd say nice things, over the radio. But there was no real way to connect with them because they would call and then, be gone. And some people called every week. I had a few people that would do that because they had a lot of questions. And I would see spikes on my website as to when we did the show, how many people were listening and where they were coming from. We had people from Europe listening to the show. So, always amazing to me. But here at least we have connection. People can ask a question, email that through social media, the website. I can contact them back and give them a good answer. So it's just so much more fun than just broadcasting on the radio and not having connection. Now I kind of feel, when musicians and singers and people talk about doing live shows and they're out there and they feel the audience. Of course, there's a massive visual when they're performing, But the connection with people going back and forth, is terrific. And I understand how these people, feel. So, as I say, thank you so much for listening. God bless you all. Call us at the office, 516-794-0404. Email the website, drcalapai.com. Tell everybody we'll be back here tomorrow at 2:30 with more cool stuff. And maybe Louis will be here, my co-host.